Take Charge with Dr. Chichi was one of the sponsors of the first Oncology Nursing Conference here in Nigeria at the Babcock University in Ogun State. It was really an amazing time and I really had fun and I learned a lot too. And I'm one of the presenters of this conference and it's been great creating awareness about burnout and touching people's life and nurses are taking charge of their life. Of course, we need self-care and sanity in order to continue to take care of our patients.
Part 1. Burnout is global. Nigerian oncology nurses speak. Burnout is not a weakness, it's not a failure, and it is not limited to one country. During the Oncology Nursing Society conference in Nigeria, oncology nurses spoke honestly about their burnout. No scripts, no filters, just truth. So this episode launches a powerful series reminding nurses everywhere burnout is global, burnout is real.
Welcome to Take Charge with Dr. Chichi, where nurses take control, break barriers, and build a future of financial freedom and career success. Whether you're burned out, ready to level up, or looking for the blueprint to thrive, you're in the right place. It's time to lead, grow, and win because your future starts now. Here's your host, Dr. Chichi.
Welcome to Take Charge with Dr. Chichi, a space where nurses and healthcare professionals learn how to reclaim their peace, purpose, and power, especially after burnout. I am Dr. Chichi, and on this show, we believe that burnout is not the end of your story. It's a signal that something needs attention, and together we learn how to take charge. Today's episode is special. It's really, really special. It begins a four-part global burnout awareness series featuring Nigerian nurses whose voices deserve to be heard. Burnout is not a personal failure. It is not a lack of strength. And it is not limited to one country, one hospital, or one healthcare system. Research confirms that nurses already know burnout is a global issue. Across continents, nurses report emotional exhaustion, overwhelming workloads, staffing shortages, and the constant pressure to keep going no matter the cost. During the Oncology Nursing Society conference in Nigeria, I had the opportunity to have a face-to-face chat with Nigerian oncology nurses who didn't just talk about burnout, they felt it, lived it, and carried it. There were no scripts, no filters, just truth. So this episode begins a four-part series amplifying Nigerian nurses' voices, especially awareness is the first step toward healing. So the theme for this episode is burnout has no borders. When oncology nurses speak, the world must listen. So I had the opportunity of talking to a nurse, two nurses actually. On this episode, I'm going to present the two of them. And the first nurse is Nurse Nana Lawal, an oncology nurse and a course coordinator in a nursing school in Abuja, Nigeria. A mother. She shares how burnout shows up in both her professional responsibility and personal life while serving in oncology care. But also, I had to have chat with Geraldine Ugwebu, an oncology nurse and the deputy director of nursing in Enugu, Nigeria. She speaks candidly about excessive workload, chronic pressure, and frustration from carrying too much responsibility for so long. These two nurses are in different parts of Nigeria, but they share the same experience and the same story burnout. So listen to my conversation with them about burnout and how they take charge.
Hello, how you doing?
I'm good.
Good. All right. What's your name?
My name is Nana Hawalawal Adeyemi.
Okay, good, good. Are you a nurse?
Sure,
Okay.
I'm an
So,
oncology nurse.
oncology nurse. What's your role?
Right now, my role is I coordinate a nursing oncology college where we
Wow.
train nurses to become oncology nurses and be licensed to practice as oncology nurses
Okay.
in Nigeria.
Wow. Have you ever experienced burnout?
Oh, yes.
That's always everybody's
Oh
reaction. Have
yes.
you ever experienced burnout? They're like,
Oh
sure, yeah, of
yes, yes,
course.
yes,
Wow. So
yes.
what's burnout for you?
For me, is when you begin to maybe as a result of the things you do every day. Like for me, when I was a practical oncologist, when I was clinical,
Uh-huh.
I was all into oncology nursing. I
Mm-hmm.
do a lot. It's my passion to be able to see a smile in the patient's face, for patients to tell me, "Thank you, Nana. I
Mm-hmm.
really appreciate this." So I go all out to do as much as I can, to give
Yeah.
as much as I can with all my heart. I do the nursing. So, but at a point, I got to a point where my roles keep changing. I became a CNO. I became in charge of a ward. Now you have to manage people who are taking care of cancer patients.
Mm-hmm.
It's not an easy task to
It's
get
not
people to
easy.
be at the same page with the passion you have to deliver the oncology care to the best that you can. So, at some point, you become irritable. You
Mm.
become when you any slight thing I do, I say I'm tired.
Mm.
I'm tired. How can I get some rest? But I have a husband who is very conscious about your mental health.
Mm.
He'll be like, my wife, you look tired. Do
Mm.
you really have to go today?
Mm.
That's when I began to realize that
And you
yes,
probably don't even want to go,
I don't want to
but
go.
you just have to because you're
Exactly.
compassionate
Sure.
about what you do.
So that's the way I look at it. You become irritable. In fact, sometimes you don't even want to do anything. You just want to be sometimes it's a thin line to drag you into depression.
Yes, exactly.
So that's the way I look at burnout.
So
I
for
believe
you, yeah,
I believe that we need to take things slowly.
slowly.
I've learned to do that now. I've learned to be able to probably draw a line, have my thermometer to tell me the temperature, the level of your stresses.
It's getting up.
So can you just stop here, do something for me that is actually for me that will help me to rejuvenate back to my normal
Normal self.
resilient self. And
And you know what you just shared? You just told me how you take charge, like how you slow down and
yes,
figure out what you're going to do
yes,
next, being intentional with what you do.
yes.
So, do you have another way that you take charge?
Sure, I have several ways. Like my husband knows that I like I like to go out. We go out together once in a while, but even sometimes I hang out with my friends.
Mm,
We go out, we have fun, we just bring back imagery, memories of when we
mm-hmm.
were, all the things we used to do
When
anyway,
you're
and
young,
that helps to,
rejuvenate
because
you.
that's my own time. I mean, talking about us, myself, and maybe other friends that are
Mm-hmm.
close, that helps us to
Me time, I like that.
me time.
That's amazing. Thank you so much for
You're
your time.
welcome.
I
It's
really
my
appreciate you. I would
pleasure.
really love to have you on the show
No
on my
problem.
podcast so we can talk a little bit more about creating awareness about burnout and helping other healthcare professionals take charge of their life and then
I'm
reclaim
in.
their peace
I'm
and
in. I'm
purpose.
in. I'm in.
Thank you so much
You're
for your
welcome.
time.
It's my pleasure.
All right. Bye
Yeah.
bye.
Bye.
Hello. How are you?
I'm fine.
Good. Good. What's your name?
My name is Ugwebu Geraldine.
Ugwebu Geraldine.
Yeah.
What's your profession?
I'm a deputy director nursing working in University Teaching Hospital at Kozal, Enugu.
Wow. Good to meet you. Good to meet you.
Good to meet you too. And
Yes.
your name
My
too?
name is Dr. Chichi.
Dr. Chichi, good to meet you.
Thank you so much. Thank you so much.
Thank you.
So what's the next question I have for you is, have you ever experienced burnout?
I've been experiencing it because of the number of patients we are handling. A nurse can be handling many patients. Only
Wow.
like now we're having only just few nurses working with many patients.
Oh my goodness.
Because of the working condition is in Nigeria is not conducive for some of our nurses. So some that has an opportunity to travel outside left us and traveled outside for them to get well paid at the end of the day. So in that case, only few nurses are remaining in the hospital, and the few nurses are meant to take care of the number of patients in the ward, in the clinic. And presently, I'm working in a radiotherapy and brachytherapy center.
Wow.
I'm the one in charge of that radiotherapy and brachytherapy center in UNTH. There will have many patients. Many patients that will come for radiotherapy, that will come for CT simulation. Because first of all, they will come for CT simulation. These patients will be simulated. After the simulation, when the CT planning is done, they will come for treatment. So we'll handle them, we'll handle brachytherapy. You give them health talk, take care of very ill ones,
Wow.
observe, do assessment. But I will come to work in the morning and go in the evening. I have a lot of patients to take care of. Even those that are anemic, you run around for
Oh
their
my
blood.
goodness.
You
Wow.
call the lab to come and take the blood sample for urgent full blood count and transfusion. So all these things at the end of the day, by the time you get home, you are weak, you are burn out. Tomorrow you'll come out again
To deal
and
with
to
with the same
deal with
issue.
some patient
Oh
and
my
it's
God.
dealing us.
That's not, I mean, you just sound, I mean, I know you enjoy what you do, but it sounds like the job is really exhausting.
Yes,
Wow. Wow.
I'm enjoying it because I'm trying to save life.
Yes.
And
Yes.
cancer patients, some of them are critical.
Yes.
Some of them are critical.
Yes.
So,
Yes.
and you must save life.
Yes.
You must save life. I'm enjoying it. I'm enjoying it. I'm enjoying it. But the problem is there that at the end of the day,
The workload
the workload,
is too
because
much.
of the excess workload, I'll be experiencing burnout. And
Wow.
tomorrow I will come back again and start all over again.
Yeah, you know, they said that most of the time, people that are experiencing burnout still stay in the same environment that is burning them out just because of financial commitment. So, do you think that will be the case for you?
To stay in the same.
Yeah, because you have to pay bills, you have to take care of your. So
Because the pay it's a peanut
yes,
to
yes.
to 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 compare it with the workload.
So how do you take charge
I'll take charge of my
of yourself from all this exhaustion and burnout
with
and
the little
overwork?
things we are getting from them as peanut, as salary. Using it to take care of myself, fuel my car, take care of my family. But I don't have any that is I can't
But do you take a break from the exhaustion?
break unless you come to hospital, you come to work with maybe with food or snacks. So within the period of work, you can tell your subordinate, please let me go and
Do,
sit.
do, do you take vacations, like take time off
We
and
take
just
annual
relax and
leave.
breathe?
There's
Annual
the
leave.
annual leave, 30 days annual leave.
Wow. How
You
many
come back,
days?
30 days.
Oh,
You
wow.
come back and stay and start again.
Start all over
And
again.
start all over. Even within that 30 days,
They're probably calling you.
as the head of the unit, them can call you for one or two reasons to come and sort out some certain problem. You
Wow.
must come.
On your vacation time
You
too?
must come. You will not tell them that you're on leave.
Oh my goodness.
Yeah, you must
Wow.
come.
Wow. Well, thank you so much
So
for sharing your story.
it's telling on us.
Well, at some
Really
point you
telling
have to
us.
take charge, you know, do something to help you. Like when I ask some people, I say, how do you take charge? They say, I do me, which
Okay,
is,
okay. Do you know that in our center, because of the number of patients coming for CT simulation, who are the one cannulating patients, especially patients that will be simulated with contrast. We nurses are the ones cannulating these patients because you wait for doctors for hours. You call them, they will tell you that they're on ward round. You call them again, they will tell you that they're on seminar meeting, seminar presentation. And these patients will be waiting and waiting and waiting. At the end of the day, few patients will be simulated. So at this point, we now started stimulating this patient for the interest of the patients. So we're adding it to our workload. But we are just doing it to help patients. Initially I told you that I'm enjoying the work.
yeah,
I'm enjoying it. But what is wearing us now is this burnout.
this burnout. Yeah. So this conference actually is a break for you.
It's a very big break. Even as I'm here, I've been answering calls. Today, we'll have brachytherapy today. And
Wow.
I've been making arrangement for this bracket since 2 days. I was the one that called the woman to come for bracket. She came yesterday. We lodged her in a hotel. So today she will be treated. My subordinate have been calling me, asking me, some questions in different where my attention is needed. But at least it's a kind of break.
It's a break. Yeah. At least you're not there
I'm
running around.
no,
We need
I'm
this
not
break,
there
I'm telling
running
you.
around. Do you know that sometimes I will come to work in the morning from morning till afternoon. I've not taken any meal.
You need to eat.
So no time to eat. You go and give them hair talk. You give them their medications. You follow them, observe them. Critical ones, you continue your assessment. You observe. You take some of them to the doctors.
It's actually good. It's actually good to take a break, I'm telling you. Because I can feel the exhaustion, I can feel the stress. It's good to take control of your life. If not, you'll be gone and the job will still be there.
Yeah.
So that's part of the reason why I do this, creating awareness so people can tell their stories, vent, and then learn from other people how they took charge of their life, right? So that at least they can keep on living for themselves and their family.
Thank you.
Yeah. But thank you
Thank
so
you.
much
I
for
think
talking
this
to me.
conference, I learned a lot from it.
Yes, yes.
One of the speakers,
Yeah.
mentioned something like this yesterday. I learned. I'm learning a lot.
That's good. That's the essence of coming to this kind of conference,
Yes. Yes.
networking and doing good for yourself.
Yeah.
Thank you so much for your
Thank you. I'm
time.
grateful. Thank you for this opportunity.
Thank you.
God bless.
God bless you.
What these oncology nurses shared reflects what nurses around the world are experiencing. Burnout thrives in silence, especially in high intensity specialties like oncology. When workload is heavy and emotional labor is constant, something eventually gives. But if their story sounds familiar, it's because burnout is speaking a loud global language. So as you listen, ask yourself, where do I see myself in their stories? What have I normalized that is actually burnout? And what signs have I been ignoring because this is just how nursing is? Many nurses remain silent in burnout because of financial pressure. So reflect honestly. Ask yourself, am I tolerating burnout because I feel financially trapped? What would change if I had clearer financial direction or support? What is one small step I can take to reduce financial stress while protecting my health? So share this episode with a nurse locally or globally. Start the conversations about burnout in your workplace. Burnout is real. I see it. So subscribe to Take Charge with Dr. Chichi so you don't miss the rest of this series. What you heard today is not weakness. It is honesty. It is only part one of our Nigerian Nurses Burnout series. So in part two, you will hear more oncology bedside nurses across Nigeria share their lived experiences, including the breaking point that forced them to confront burnout head on. But until then, remember this, burnout does not define you, and you are not alone. Just continue to take charge. Bye.
Take Charge with Dr. Chichi is a brand of Sparkling Star Development Strategies LLC. The information provided is for educational purposes only and does not constitute financial, legal, or medical advice. Financial services are offered independently by Dr. Chichi in accordance with applicable licensing and regulatory standards. Thank you for watching.